This is a series of videos that we're using to teach medical students about the physical examination. When you first get into medical school, you have to learn how to take a history from somebody, so how to get the person to tell you their story, and then also how to do a physical exam. We think it's really important for medical students to learn about what's different about doing this in older adults. We call it geriatrics. I hope that you'll enjoy these videos as well. What are the 5 things that I want you to know about thyroid disease in older adults? So before we start, let's just do a quick little review of the thyroid system. In the hypothalamus, their thyrotropin-releasing hormone is released, and this acts on the pituitary gland, which is also in the brain. This releases TSH, thyroid-stimulating hormone, which stimulates the thyroid gland. The thyroid gland is found in the neck, and it releases thyroid hormones, T3 and T4. These hormones act in many places in the body. They act on muscle, bone, the circulatory system. So when the thyroid gland is dysfunctional, there are many parts of the body that are affected. Here's a list of some of the common signs and symptoms if the thyroid gland is overactive, or if someone is what we call hyperthyroid, and the symptoms if someone is has an underactive thyroid gland or is hypothyroid. But what about thyroid disease in older adults? Well, number 1, let's talk about some of the normal changes in the thyroid gland with aging. As people get older, the level of TSH, or thyroid stimulating hormone, goes up. In fact, in people who are 100 years old, their TSH seems to be quite a bit higher than younger people, even younger, older people. There is a theory that having a higher TSH might actually be protective, and it might be something that contributes to longevity. We'll talk a little bit more about that later. The thyroid gland does become a little bit smaller with age as well. But it's quite common for older adults to have thyroid disease. About 20% of older adults, or those over 65, have some kind of thyroid dysfunction. But changes in thyroid tests are not always dysfunctional. Number 2, have you heard of sick euthyroid syndrome? So when someone is ill with a non-thyroidal illness, it can still make changes to the thyroid function tests. When someone is ill with, say, an inflammatory illness or an infection, their TSH can be suppressed, and during the recovery phase, the TSH can actually be elevated. Usually the levels of thyroid hormones are normal. So if you think that someone has a sick euthyroid syndrome, that is, that their TSH isn't normal, but they don't really have signs of thyroid disease, then it might be worth checking their TSH again in a few weeks after their illness has resolved, just to make sure that they are euthyroid. Number 3, older adults are more likely to be on medications that can interfere with thyroid function. I'm going to list them here, and they include some common cardiac medications like amiodarone and furosemide, but also things like phenytoin and others. So if you're seeing an older adult, it's probably important to look at their medication list if there's thyroid dysfunction to see if the medications could be the culprits. There are also some compounds that can interfere with the absorption of thyroid hormone. So if somebody has been prescribed a thyroid hormone replacement, but their TSH is still very high, then it could be because it's not being absorbed properly. So things like iron and cholestyramine can affect thyroid hormone absorption. Number 4, and this brings us back to those 100-year-olds with the slightly elevated TSH. There's a condition called subclinical hypothyroidism, which has kind of been a long-standing controversy in geriatrics. Subclinical hypothyroidism is when somebody's TSH is greater than a normal range. Usually, though, it's less than 10. But the person does not really have signs of thyroid disease. And the thyroid hormone levels, free T3 and free T4, are usually normal. This is what we call subclinical hypothyroidism. There's been a lot of debate and study to determine if we should treat subclinical hypothyroidism, if that would improve people's mental state or would just be good for them overall. But we don't actually treat subclinical hypothyroidism unless the TSH is greater than 10 and there's some compelling reason to do so. Don't forget that thyroid hormone has effects on numerous body systems. It can cause tachycardia or an increase in heart rate, and it can also increase basal metabolic rate. So it's not something that we really want to inflict on older adults unless we're actually providing a therapy that's going to be beneficial. So we should know about subclinical hypothyroidism, and most of the time we choose not to treat it. The final thing that I want you to remember is that older adults can have those atypical presentations of disease. Think back to the common symptoms of hyperthyroidism and hypothyroidism. They can mimic many other disorders, especially the hypothyroidism. But in older adults, sometimes there can be thyroid disease without the classic disease presentation. In younger people, only 30% of them will have 2 or fewer symptoms of hyperthyroidism. But in older adults, up to 50% of people will have 2 or fewer symptoms of hyperthyroidism. So it can be harder to pick up on that disease. So always keep in mind that an older adult may not show up with classic symptoms. And it might be worth checking a TSH if you're seeing somebody for non-specific symptoms like weakness or confusion. Doing a TSH is actually part of the recommended screening if we're seeing an older adult who is presenting with what we think might be a dementia. Most of the time it's normal, but I have had a few patients who've had a disordered thyroid, which is the reason why they are confused and look like they have dementia. And then when the thyroid is replaced, thyroid hormone is replaced, the person is a lot more like themselves. So I hope that that's helpful. And just to briefly review, there are some changes in the thyroid that are normal. TSH goes up with age. There is a condition, however, called subclinical hypothyroidism, where the TSH is elevated, but we don't usually treat it unless the TSH is greater than 10. There can be numerous medications and medical conditions that can affect thyroid function tests. Always think about the atypical presentations of disease that older adults can have. So thanks for watching, and if you want to learn more about aging, please go to www.thewrinkle.ca.